come on.
This is Kate. Can you hear me now?
Yes, I can now, Kate. Welcome.
Yay! Thank you.
Oh, I think Irene is now connecting as well. Okay, so I think Irene, maybe you're having some challenges there with your microphone, but we'll get back to you during questions. I think we're now live on YouTube, so we'll get started. Before we begin with the media briefing, I just want to remind everyone that beginning next week, we will be going to one media briefing a week, and that will be on Tuesdays. And you'll get the information about that as we normally do. So today we're going to hear from Acting Medical Officer of Health, Dr. Hsiu-Li Wang, as well as Chair Karen Redman, and CAO Mike Murray, who's going to provide an update about enforcement. So we'll get started with Dr. Hsiu-Li Wang. Go ahead, Hsiu-Li.
Good morning, everyone. So as you are aware, Region of Waterloo Council voted in favor of the face covering bylaws, requiring face coverings in all enclosed public places and on transit. That goes into effect on Monday, July 13th. This additional measure, when used with physical distancing, hand washing, and self-isolating and seeking testing if you have symptoms, will help us better protect each other. Many residents have already begun wearing masks or face coverings in public settings, but this will also be new for many other residents. For those residents, I encourage you to practice wearing your face covering at home. Get used to how it feels and make adjustments to the ties or elastics so that it fits comfortably and snugly. Face coverings are made and fit differently, so it is important to learn how to wear yours. Not everyone is able to wear a face covering, so I would like to really encourage all residents to please show kindness to those who are not able to wear a face covering. And lastly, remember that this bylaw also does not apply to outdoor settings like splash pads, trails, or parks. In these settings, please maintain physical distancing between yourself and those not in your social circle. It's been 4 weeks since we've entered stage 2 of the reopening. I would like to recognize the efforts of each and every resident in Waterloo Region. We have made significant progress over the past 4 months, and all of your efforts are making a difference. Currently, there are no outbreaks in Waterloo Region, and our new cases continue to be stable, but there is still uncertainty ahead. The pandemic is not over. We do not yet know when the province will move to stage 3 as part of the plan to reopen Ontario. We also do not yet know whether there will be a second wave of cases. And if so, when it will happen or how significant it would be. No community is immune to a resurgence of cases of COVID-19. In Waterloo Region, like elsewhere, the rate of new infections in our community could easily increase if we become too relaxed with our measures. This is why continuing to practice public health measures is at the foundation of our new normal. Through your efforts and actions, we can continue to protect our community, our family, friends, and neighbors. Together, we can continue to make a real difference in Waterloo Region. Thank you for all of your efforts.
Thank you, Hsiu-Li. We'll now hear from Chair Karen Redman. Go ahead, Karen.
Thanks, Julie. Monday will mark the first day of the region's new face covering bylaws, which require us all to wear masks or face coverings in all enclosed public settings and on Grand River Transit. This is an important step in helping our region safely reopen and move from stage 2 to stage 3 in the near future. When we keep our germs from others by wearing a mask, we help reduce the virus from spreading. It's a simple and inexpensive action that we can take to take care of each other. However, not all of us can wear a mask. It's important to show kindness to those who are unable to wear a face covering. Many health issues and disabilities are invisible, and the bylaw does not require people to provide proof of an exemption. If you see someone not wearing a mask, assume they have a medical reason for not wearing one. We all need to continue to respect one another as we adjust to this bylaw. On Monday, Grand River Transit will be distributing free masks to transit customers. GRT staff will distribute 40,000 non-medical masks over the coming weeks as part of their education program. We've got you covered. This weekend will be a busy time for businesses preparing for the implementation of the bylaw. We now have a mask bylaw page on our website dedicated to business. It has lots of information, frequently asked questions, and resources. Businesses can print bylaw posters, bylaw reminder cards, and more. Staff are working hard to add more resources for businesses so we can appreciate your patience. Visit www.regionofwaterloo.ca/maskbylaw-biz for more information. I'm sure many of you have noticed the installation of temporary cycling lanes on regional roads. Staff are in the process of setting up 30 kilometers of new temporary bike lanes. The full installation should be completed by late July or early August. These extra bike lanes will allow for proper physical distancing on busy sidewalks and will continue through the summer to October 2020. If the weather permits this weekend, I encourage you to get out and test one of them. Have a safe weekend, everyone. Thank you.
Thank you, Karen. We'll now hear from Mike with an update about enforcement. Go ahead, Mike.
Yep, thanks, Julie. This will be a really brief update about enforcement over the last week or so. So over the last week, our enforcement partners, so regional bylaw, area municipal bylaw, police, and public health, 86 site visits that involved education or warnings, 214 site visits where no action was required, and 1 new charge laid. And the new charge was a private residence in Waterloo with a private gathering of more than 10 people. So in violation of the emergency order restricting public gatherings to less than 10. So that brings the total charges laid to 24 for anybody who's counting, and about 300 interactions with people over the last week. That's it.
Okay, thank you, Mike, and thanks to everyone who presented. We'll now turn it over to you for questions, and we'll start with Damon from the Woolwich Observer. Go ahead, Damon.
I have a quick question for Karen Redman about these new bike trails. Is there a way we can find out where they're being implemented?
Well, there was a report that came to council and was approved. I'm going to defer to Mike Murray and say, is there a map on our website? I think there should be.
Yeah, so that's a really good question. I'm assuming that on our website, there'll be a list of where we're installing bike lanes. We'll get back to you, Damon.
Okay, that's all for me.
I'm looking to Julie, so we'll make sure we get you the list of locations and also where you can find that information easily.
Okay, great. Thank you. That's all for now.
Okay, thanks, Damon. Tim from 570. Go ahead, Tim.
Hi, good morning. Dr. Wang, how has the order been going for owners and operators of farms and the foreign temporary workers?
Oh, and thanks for the question. Yes, so far, so good. Along with the Ministry of Labor, we are continuing to follow up with these farms and have been in communications with all of them. There's only currently 13 that have temporary foreign workers. 2 of them do not have any at this time. So we're continuing to work with them. We don't have any cases yet either.
Okay, and Chair Redman, the Economic Recovery Committee met yesterday, and for the next meeting, have staff provided you with new details on how Waterloo Region can recover?
So it's an ongoing process, and we're looking at eliminating red tape and identifying actions that the region can take to promote business. And that might have to do with our planning process. And I know that was one of the things that the staff presented on yesterday. There's also a scheduled town hall meeting. We're hoping people will come and provide their ideas. So it's an ongoing identification of actions that we can take. And this economic recovery task force will feed into the budget process.
Okay, those are all my questions for now. Thank you.
Okay, thanks, Tim. We'll move over to Joanna from the Record. Go ahead, Joanna.
Thank you. Just a question for Dr. Wang first. Can you tell us a bit more about the new death that was reported today?
Yeah, I will have to get back to you on that. I've just been informed of that. So I don't have any new information at this time. Yeah, I wasn't informed about that yet. So I'll have to get back to you. Sorry, we'll have to get back to you on that.
Okay. And then I'm not sure if this is for Chair Redman or Mike Murray, but the free mask giveaway on Grand River Transit. It sounds like a fair number, but also, you know, it's first come, first serve. How far do you think these will go, and why specifically target transit and not sort of the general public?
Yeah, so I would just say a couple of things. We'll see. I think, you know, what we're seeing is more and more people are wearing masks on transit. And I think the announcement of the bylaw passing, I think has sort of raised that awareness. So lots of people have their own masks, lots of people are bringing their own. So, you know, and hopefully not everybody needs or wants a free mask from the region. So we'll just have to see how far it goes. We want to make sure that, you know, access to a mask doesn't become a barrier for people. And, you know, we're hoping that it's not, but that's part of the reason for the giveaway. And targeting transit, you know, what we feel is that is a direct program service that the region is directly responsible for. And so, you know, we want to make it as easy as possible for our customers to wear masks on transit. And so one of the ways we can do that is, you know, remove any barriers to access to masks. So that was the thinking behind us, you know, and the mask giveaway on transit.
And if I can just add two little points, Joanna, my understanding is of the 40,000 masks, half are reusable and half are single use. So we're hoping it will empower people that are regular transit users to reuse at least the 20,000 masks that are being handed out. And we recognize that as ridership goes up on public transit, it may make physically distancing more challenging. And so this is something that we could provide the ridership with that would help protect them. So those were sort of the two reasons why we zeroed in on that particular giveaway.
Okay. And just going back to what was brought up about removing barriers. If someone is in the community, maybe they're not a transit rider, but they can't afford a mask or make a mask, like where should they go?
Well, and, you know, so we continue to look at, or the region does, you know, do we, in our buildings, for example, you know, looking at the option of, you know, getting a, you know, small stockpile of masks that we could have if somebody comes into one of our buildings, doesn't have a mask, and is looking for service in a regional building, we don't necessarily want to turn them away. A better approach would be, you know, here's a mask. So that's something that we're looking at. We haven't landed on that yet, but I think that's possible.
And if I can just add, Joanna, throughout this whole pandemic, what we've seen is the community really step up and make masks. And I know that there are service providers in the community that are providing shelter options or dealing with people who are marginalized, and they've put a call out to the community asking for donations. So I think people are being innovative, and if the past several months are any indication, our community will continue to step up, make masks, and donate them to people who may not otherwise be able to afford them.
Okay, thank you.
Thanks, Joanna. Before we move on to Nicole, I got an update about the map, and Damon, there will be, staff are working on it and it will be up on the website next week. Okay.
Yep.
So now we'll move on to Nicole from CTV. Go ahead, Nicole.
This message, I think, is for Mike Murray. You mentioned last time that in terms of the provincial fine for not complying with the mask bylaw, you were approaching the province to figure out that provincial fine. Where are you guys in that process?
Yep, so we've been directed by regional council to make application to the province for, it's called set fine. And so I would have to check and see whether that application has actually gone in, but if it hasn't, it will imminently. And then, we'll have to await the province's response. In the past, those requests have taken some time, like in the order of months. But, we're hopeful in the current circumstance, the government might respond a little more quickly. And I think as we talked about, that request is going to be for a set fine of $240 to match the fine that's in our code of use bylaw for transit.
Now, the next question, not sure who would be able to answer this one, but we've read reports where school boards are being suggested to have plans where students will be in class 5 days a week. Have local school boards discussed with the region about perhaps using community centers as additional learning spaces so that schools can properly physically distance?
So I might ask Hsiu-Li whether she's aware of whether there's any conversations between school boards and public health. I can say there's not been any conversation with the school boards that I've been part of, but it may have gone on between public health and school boards. Hsiu-Li?
Yeah, so it's the Ministry of Education that is currently providing guidance to school boards. And once that guidance has been provided, then local public health will be involved in issues of implementation and clarification that are specific to our settings in the region. But at this point, it still remains the Ministry of Education that is providing guidance to school boards. And there are still some unanswered questions. So they haven't completed that guidance to school boards at this time.
Minister Lecce did say, though, a couple of weeks ago, it's up to the school boards to determine how the return to school will be and to come up with a plan. So if the school boards in Waterloo Region were to approach public health and health officials, would you consider opening up local spaces for learning?
Again, he did mention local public health in terms of assistance in line with the provincial guidance and direction. So I think really we still have to await the more high level direction from the Ministry of Education to the school boards, and then we can work with the school boards on local implementation issues.
Okay, that's it for now. Thanks.
Thanks, Nicole. We'll go to Kate from CBC. Go ahead, Kate.
Thank you. Hopefully you can hear me. I'm just going to flag, Julie, that I would also be interested in any additional information about the latest death, just like Joanna mentioned. Chair Redman, I am wondering, you recently had a press conference with Cam Guthrie and John Tory where you were calling on the federal government and the province to kind of figure out what they're doing funding wise. Have you heard anything more on that in terms of providing funding to the municipalities soon?
So Kate, thanks for the question. And it's been a constant theme, an ongoing theme. I have written on behalf of Waterloo Region Council, as well as wearing my hat as the chair of MARCO. And that's really what the capacity within which I participated in the press conference with Mayor Tory and Cam Guthrie, Mayor of Guelph, as chair of Large Urban Municipality Caucus. And it's been a continuing theme. We've sent letters. We continue to petition the minister regularly, and quite honestly underscore the fact that it appears that Waterloo Region will be $17 million in deficit by the end of this fiscal year. And my colleagues in Ottawa and Hamilton were saying it will be $120 million deficit. A huge piece of that is the fact that we are the level of government that provides public transit. So we haven't heard back. We're in active conversations. And when we talk to the federal and provincial government, they appear to be listening, but we're telling them we are now starting to formulate our budgets for 2021, and it's essential that we know what funding we're going to get. So we continue to carry that message forward, and we felt that it was a appropriate sort of tipping point in time of planning that this be reiterated again to the province and the federal government. So that accounts for the timing. The actual message has been very consistent and will continue to be.
Wonderful, thank you. And Dr. Wang, I had a question for you as well, and apologies if this was asked on Tuesday. We have seen a real debate in the region over masks and people who are very much against them, people who are very much for them. I'm wondering if, looking back now, if you regret not just making the Order 22 to say, yes, everybody has to wear a mask, now that this has become such a politicized issue.
I think that the process that we followed in our region was a good one. You know, the regional council made a decision, you know, a policy decision for the community, and I think that the approach that the approach that we followed was the most appropriate one for this type of question. You know, the bylaw approach as approved by regional council, I believe, was the most appropriate approach for policy issues such as this.
And, you know, if I could just add, it certainly provided an opportunity, a mechanism for public input. You know, anybody who followed the council meeting on Monday, you know, I think we had 3 hours of delegations. And as you note, there's strong views on all sides. And so by following this process, I think regional council, as the policymakers, were actually able to hear from the community. Chair Redman can comment. I know that councillors got hundreds, perhaps thousands of emails in addition to the 20 or 30 delegations we heard from. So, you know, I think that's a pretty robust process, and it provides an opportunity for the community to weigh in, and it provides an opportunity for our elected officials to make an appropriate policy decision. And, you know, that I think kind of respects the democratic process a little bit more than, you know, just issuing an edict. And I'm hopeful that because of that public process, that the community will be supportive of the direction that the regional council has taken.
And if I can just add too, it was an amazing example of civic engagement, I would tell you. And I don't want to put words in Dr. Wang's mouth, but consistently all along, she's always identified mask wearing as one of the tools in our kit, along with hand washing, staying home when you're ill, certainly physically distancing, and getting tested if you have symptoms. So it's always been part of the suite of public health guidance that she's provided. What the bylaw allowed us to do was, one, be very definitive about the order of use on public transit, which I feel was very supportable. It's a direct service that the region offers, and we're trying to mitigate the impact for anyone that can't acquire a face covering or a mask. But the bylaw changed while we had that debate and while we listened to people's interventions. And I think that the community were very entrenched on both sides in what regional council tried to do, and it was a unanimous motion passed by regional council, was to say, we're trying to strike a balance. And we didn't want to put the onus directly on business as part of the enforcement mechanism. We definitely need business to be a partner with us in the education, which is why we're providing the cards, why we're providing notices that can go up in their window, and the authority of the regional bylaws saying people need to wear masks in indoor public spaces. Having said that, in public spaces, but having said that, there were some changes that were made due to the information we were hearing. Sorry. And I would hope that the community would at least see that we tried to strike a balance, and we tried to provide tools where business can continue on their economic recovery, because we recognize that we need to find the new normal, and we feel wearing masks is part of that.
Yes, and I'll just quickly add one more thing, is that, you know, I was really pleased to see that the bylaws that are passed does put the responsibility on all of us who can wear masks to wear masks, reinforcing what we've been trying to say all along, which is that it's a collective responsibility for us to protect each other. So I'm really pleased about that. And as you know, Mike and Chair Redman have said, I think this strikes a good balance. And I think it was the most appropriate approach to take in our community in the end for this type of decision.
Great, thank you all. Those are my questions.
Okay, thank you, Kate. It looks like Irene has left us. So does anyone have any follow-up questions before we wrap up? Okay, Joanna, go ahead.
Just carrying on with masks. On Monday, when the bylaws come into effect, are you, I'm not sure who wants to answer this, or maybe all of you, are you concerned that there might be some confrontations or people who are very vocal about not wanting to wear a mask?
So I'll take that one to begin with. And you know, Joanna, I think there is a real acknowledgement that people are very entrenched on either side. The reason that our community spread has been manageable and continues to see low numbers is because the public has really bought into doing things for the greater good. So I would tell you all along, there have been people choosing to wear masks even when it wasn't mandated. There are people who go into stores now where the store has said you need to wear a mask, and they have chosen to shop somewhere else. So I think people still have choice. I would hope that people don't become militant. And again, I said this in my comments at the beginning, but I really hope that people will look at somebody else who is not wearing a mask and assume that they have a medical exemption. There is no need for somebody who has a medical reason for wearing them to have to justify it or explain it to anybody. We also were very sensitive to the whole issue about hearing impaired people. And so we try to accommodate that by saying that if you have somebody with you that needs to interpret for you, they too can be exempt from wearing a mask. This is meant to be something that is easy to comply with, that people will choose to comply with, and that those who are complying with it will not become vigilantes when they see somebody not wearing masks. I mean, anecdotally, we've heard all along that there are people who feel quite militant, and we really hope that people lay down those weapons and are kind to each other, because we're in this for the long haul, and we are in this together as a community.
Okay, any other questions? None. Okay, so before we wrap up, I just want to acknowledge that today is our CAO, Mike Murray's last media briefing before he begins his retirement. Mike, we want to thank you for all the support and leadership that you've provided. You've been the face of the region many times over the years, and we've really appreciated your support during the pandemic and participating in these briefings. So thank you so much, and we wish you well, and we'll carry on the good work that we've been doing with you.
Well, thanks, Julie. And I don't know if I'll get the last word or not, probably not. But you know what, I actually really want to thank our media partners. You know, it's, I don't know if you call it a partnership or not, but I think it's been an unprecedented time over the last 4 months. The region has tried to be open, honest, transparent, and timely with our information and communication. And I think all of you have helped us deliver that message to the community. And you know what I've heard from the community is people have appreciated the media briefings, appreciated the information, and appreciated the clarity with which it's been communicated. So I just want to thank all of you for helping us get the message out. It's been an unprecedented time for everyone. And you know, I think as a community, we've done as well as we possibly could. My phone's ringing. So thank you all for that. And I've worked with many of you for a number of years, and you know, I've always found you to be most professional, and I really appreciate that.
And Mike, I'm not going to give you the last word. I don't know if Hsiu-Li, if you want to jump in, but I just want to point out that Mike's retirement date was May, and he stayed on to help make sure that this community, our constituents, and the regional council and staff were very well served. And cast your minds back to May and how much scarier the pandemic seemed now than even now. So Mike stayed on, put his personal preferences and those of his wonderful wife aside, and continued working till now. So we certainly appreciate it. And Hsiu-Li, if you want the last word, it's yours.
I would just like to echo what you said, Chair Redman. Thank you.
I'm sorry, I have to take the last word because I have to close us out, but that was lovely. So thank you, everyone. We're going to conclude the briefing, and just a reminder that Tuesday we'll be back for a briefing, and we'll only be doing one a week starting next week. We hope that you all have a very safe weekend and a healthy weekend, and good luck on your retirement, Mike. Take care, everyone.